COVID-19 testing is happening. That is part of the reason our case count is rising. A batch created with donated supplies for livestock are on the way to the valley. Valerie Gonzalez with a closer look at all the different types of tests now available.
Drive-thrus, labs, and hospitals in the Rio Grande Valley are using tests that can take a few days to let people know if they have COVID-19. These are called PCR tests.
The polymerase chain reactive PCR test is considered the gold standard right now. And this is a test that you obtain the specimen from your nose.
Hidalgo County Health Authority Dr. Ivan Melendez explains that sample collected goes through 3 phases before a machine analysis.
So it takes longer. It's more, it's very specific, but you have a spot, many spots in that chain to run out of supplies. And so that's why the PCR tests are taking such a long time.
Seeing the supply need grow prompted the Veterinary Medical Diagnostic Lab in College Station to donate materials that can be used to collect samples. They repurposed supplies usually used to test pigs, cows, and chickens and donated them across Texas.
We took a look at what was in our shelves, our storehouses here at our 4 laboratories, and we found some of the materials that could be used to do this.
McAllen is set to receive 100 of these kits next week. Timing is everything. Many are looking to a second type of test, rapid tests.
What this test does, it measures the sample that you've obtained from the person, also through a swab, to see if you have developed an antibody against, in this case, COVID-8. That means you've been in contact with it.
This promising product is out of reach for many.
So that test will be beautiful. The problem is New Jersey, New York, California, perhaps New Orleans. These are the places that will be getting it within a week to 10 days. I can't tell you how long it'll take for us to get it, but we're definitely not at the front of the line.
Yet.
So we bought 2,500. They gave us 2,500 for a total of 5,000.
Laredo announced a few days ago a purchase agreement for 5,000 rapid tests to open up a drive-through clinic. Congressman Henry Cuellar facilitated the deal with a private lab, Clear Choice ER, for $75 apiece. The city and the county would split the bill. FEMA would pay 75% of the cost. Counties in the valley have not had much luck getting tests. Hidalgo County is still using PCRs. Starr County is on a wait list for rapid tests, and Cameron County is holding back.
I can say that I'm not aware, but I'm hearing as many different stories as you are, and we need everybody to look into them before they jump, especially before they spend any money.
Turns out these suspicions are valid. One day after Laredo was supposed to open their clinic, they admitted seeing problems during standard quality control tests they performed. Today, they stopped just short of calling these tests bad.
We had been told by the manufacturer of the test and the literature that it was 93 or 97% effective, which is great. But doing our controls, we didn't like the results that we were getting because they weren't anywhere near it. And so we couldn't use them, and we decided not to use them because they weren't a good product.
Laredo officials clarified they only got 50 tests and didn't pay for the ones they ultimately rejected. Still, rapid tests are highly sought after. A physician's office in the valley is waiting on a shipment. This is a purchase agreement they shared with us for hundreds of tests expected by the end of the month. A representative from the office said they're mainly used to test for negative results. Positive results will need to be verified through more testing. It's expected to help by sorting out the possible cases. Hidalgo County's health authority says the tests are not what's most important.
I really would like the population to not focus so much on the absolute number of tests. How can I get tested? Where can I get tested? Because the treatment is going to be the same. It's just a matter so you don't expose other people.
Doctors continue reminding the public practicing self-isolation will make a test unnecessary. Valerie Gonzalez, Channel 5 News at 10.